Hello everybody, salam, sawadee ka, kia ora. My name's Hayley. I'm a speech and language therapist here in Tauranga, New Zealand, and also very privileged to be mum to 5-year-old Josie who has Prader-Willi syndrome. Here's a brief overview of what I'm going to talk about today. Everything's brief. I've tried to cram a lot in, but I hope you come away with a couple of useful nuggets for yourself. So a quick word about infant feeding, early language development, AAC, speech clarity, social language skills, and narrative intervention. Now, my quick word about infant feeding is really just a plug for this new resource put out by Libby Johnson. It's about breastfeeding your baby with Prader-Willi syndrome, and it's available for free on the New Zealand Prader-Willi syndrome website. As we all know, babies with Prader-Willi syndrome usually have difficulty feeding for the first few months of life until they enter nutritional phase 1B. So this resource is fabulous for any parents out there who are really keen to breastfeed. So check it out. Now, moving on to communication, a quick word about the difference between speech and language. So language refers to the way that we understand and use words to send and receive messages, and speech is basically how we're articulating it. So in Prader-Willi, both speech and language are usually affected in a variety of different ways. So it's important to keep both areas in mind when we're thinking about communication. Early language development. So it starts with understanding. So receptive language, what we understand. You need to understand words before you can start to say words. And babies start hearing words as soon as they're born and pretty quickly learn that those words have meaning. So the way that they learn is through context. So for example, you say to your child, put your shoes on. You're probably making eye contact with them. You might point to the shoes or even hand them the shoes. All of these environmental cues support their understanding and learning of the meaning of the words. So receptive language comes first. And in the Prader-Willi population, language development really varies. So some children understand and say a lot quite young, others need a few more years to get it sorted. Mostly there's a bit of delay there, but it does vary. So speech disorders like childhood apraxia of speech can really hold a child back. So if you've got a kid who's understanding a huge amount of language but isn't yet using much, that could be a potential factor at play there. And that last point is that parents and caregivers are really the best people to support the child in learning language. They know the child best, they spend the most time with the child. So the role of the SLT should really be to support and guide those people to facilitate language development for the child. So this advice is aimed at those of you supporting children in the first 3 or 4 years of life. Research is now telling us that these first few years are crucial for cognitive and language development. And one of the most important factors in this is the parent-child interaction. So the number of words spoken to a child is really important. Basically, the more the better. But possibly even more important is the number of conversational turns between the parent and the child. So you want to be listening to your child and responding when they are trying to communicate. So if a child's not verbal yet, their conversational turn might just be reaching for something or pushing something away or making a noise with their mouth. Just respond to these things as if they were talking to you. Keep in mind that devices take our attention away from our child. So if you're busy on your phone, you may be missing opportunities to respond to your child. I know phones are everywhere and they're essential, but just keep that in mind. This Hannon It Takes Two to Talk course is highly recommended. It's a research-based program that targets that all-important parent-child interaction. So it's available online, I believe. It is done in English. However, they are gradually compiling resources and programs in other languages as well. So keep an eye out for that. They have a huge range of different courses. This one's aimed at parents of children who are either not yet talking or just using 1 or 2 words at a time. But there are other programs they run for educators, parents of children with autism, and older children as well. So check it out. So while you're focusing on parent-child interaction in those early days, I also encourage you to start some sound play and imitation. This is a simple book that I made for my daughter when she was first learning to talk to encourage a variety of different speech sound attempts. Any parent can make something like this in any language, and you can adapt the pictures and sounds just as you like. I used some personal photos just to make it more appealing, and it worked a treat. And I do the same thing for lots of my clients. But you can use Google Images or even hand-drawn pictures if you want to. Josie got so familiar with hers that she would spend a long time on her own even with it, turning the pages and making different noises. The book can also be used to encourage vocabulary development and lots of conversation about the pictures. So here you can see you just pop the bubbles, pop, pop, pop. I try to make the noises lots of fun so they enjoy it with some action as well. Here we have woohoo and wee. Those are Josie's brothers going down the slide. Boom, bang, crash on the drums. Brum, and you can really use whatever pictures you like for this sort of thing. The possibilities are endless. Blowing out the candles on a cake, and shh, baby's sleeping. Animal noises are of course great to include, and choo-choo, or you can shorten that to ch-ch-ch. That was our pussycat, and she loved that picture with her brother. So I hope that's given you a few ideas of what you can do. It doesn't matter if your child's not imitating all of the sounds, and of course they don't have to be perfect. It's just important to keep it fun and low pressure, and of course lots of conversation about the pictures is really good as well. Now let's talk quickly about alternative methods of communication. Sometimes when a child is not yet talking, or if their speech is just very difficult to understand, another method of communication might be useful, such as sign language or a communication board or app. Some parents worry that this type of thing will hinder their child's speech development, but I want to reassure you that it won't. In fact, the research suggests that it can have the opposite effect and actually encourage more communication and more speech, so it can be very beneficial. What it does is it gives the child a way to get their message across effectively, and it will ensure that their expressive language continues to develop even if speech difficulties are holding them back. So AAC devices target language ability, and you should be working on speech sounds as well with something else. So that imitation book that I just showed you is an example of a way to work on speech sounds. There's lots of other ways that your speech therapist will probably use. Remember that learning to use an AAC method takes time and effort. It doesn't happen overnight, and everybody in the child's environment needs to get involved, including and especially other children. Speech clarity is almost always an issue in one way or another for our children, some affected more than others. So these are some of the main things that we're dealing with: childhood apraxia of speech, phonological delays and disorders, and articulation disorders and imprecise pronunciation. Childhood apraxia of speech is a bit of a biggie with our kids, as you can see from those first two bullet points. Around 45% of people with Prader-Willi syndrome are diagnosed with childhood apraxia of speech, which is quite a large percentage. What apraxia is basically a difficulty with the way the brain communicates with the speech muscles to coordinate movement. It can be very, very severe, or it can be quite mild. It affects not only speech clarity, but also prosody. So that's intonation and rhythm of speech. And as I mentioned earlier, if a child's speech is severely limited by apraxia, it will have a significant impact on their expressive language, which is why it is so important to feed in that language wherever you can and try to build that expressive language through an alternative means of communication if necessary. Apraxia of speech is diagnosed by a qualified speech and language therapist, and that person will gather plenty of information to form a plan around the best treatment approach for that child. There's lots of great information online if you want to look more into it. The Child Apraxia Treatment website is a really good one, and I've listed here the components that they refer to as vital in the treatment of childhood apraxia of speech. They're very true. So frequent and intensive practice is an absolute must. I'm talking like several times a day if possible. The treatment needs to focus on speech motor movements rather than specific sounds. Prompting needs to be multisensory, so visual, auditory, tactile, or the use of actions. Treatment will use specific types of practice and specific types of feedback, and it needs to focus not only on clarity but also on prosody. So prosody includes phrasing, rate, pausing, intonation, rhythm, and stress. Prosody is used to convey meaning, including mood and emotion, so it is an important one to work on. So as you can see from this slide, there are plenty of different options for treatment of apraxia. So all of these approaches pretty much tick the boxes on that previous slide. Each of these is slightly different, and your SLT will be able to make an informed choice based on the level and needs of the child. The one that I have seen popping up quite a bit on the Prader-Willi parent groups is the prompt therapy, the one at the bottom. But that's the one that actually requires specialist training, so is more difficult to access. The other 4 approaches listed here have good solid evidence behind them and can be carried out by any qualified SLT. So again, there's plenty of good info online if you want to delve further into any of these. Check out my references at the end. There's some websites on there. For those kids who do not present with childhood apraxia of speech, many will still have some form of speech sound difficulties, whether that be a phonological or articulation disorder or a bit of both. When a child is very young, the only real focus you'll have on speech clarity is some of those fun speech sound imitation activities. I wouldn't do any more than that until the child is at least 3 years old. Up until that point, your main focus will want to be on language development rather than speech clarity. The age at which to start some formal speech sound intervention will very much depend on the child and family. Some will be ready at 3, others might need until they're 4 or 5 or even older. So I've mentioned on that bottom bullet point a family's availability for practice, simply because seeing a speech therapist a couple of times a month or even weekly isn't really going to make a huge amount of difference unless somebody is practicing daily with the child. I often suggest intensive bursts of treatment as a way to make things more manageable for families. Often families are able to buy into intensive practice if they know it's only going to be for a short, say 6-week burst at a time, and then they know they're going to get a break. This can be a really effective way of doing speech sound intervention. Social communication is an area of huge challenge for most people with Prader-Willi syndrome, and one that is so important. We are learning more and more all the time about how important this is for our kids. I've listed here some of the most common things that our kids often need extra help with, but this list could probably go a lot longer than this. Teaching language for emotions and learning to recognize emotion in others is a really big one that you can start from a very young age. There are lots of great resources out there for social emotional skills, and I encourage you to do your own research and find what best suits your situation. This website, socialthinking.com, I cannot recommend enough. They have lots of free and pay webinars on various topics, as well as resources you can buy. As far as I know, they are all in English, so just keep that in mind. We Thinkers is a group style program. This picture that I've got on the slide is the first book from that series. It's a program that can be run in small or large groups, and it teaches social cognition skills. It's really, really powerful stuff, and I do recommend you look into it. The last thing I want to leave you with is some ideas around narrative language or storytelling skills. Research tells us that narrative skills are generally impaired in people with Prader-Willi syndrome. Research also tells us that a child's narrative language ability plays a huge role in their academic skills. So it makes sense to target this with our kids, and in fact our adults as well. So it's basically teaching them how to understand and tell a story. So stories are everywhere, not just in books, of course. They're woven through our everyday lives. So for example, your 2-year-old comes in and shows you a scratch on their arm and says, "Cat, ow." There's a story there. Your teenager comes home from school with only one shoe. There's a story there. Whether or not they choose to tell you it. You watch a really interesting movie and you tell your partner all about it. That's a story. So storytelling happens all the time, all around us, and the more a person is able to participate in that, the better. Working on narrative skills improves grammar and vocabulary, but it also targets emotional intelligence, memory, reasoning, and the all-important theory of mind. So, hopefully I've convinced you. A story generally has 5 basic elements you see there on the 4th bullet point. So we've got a character, a problem, the feelings, an action, and an ending. There are additional elements that are added for a more complex story, but these are the foundational elements of a basic story. You can talk about these elements in everyday life when incidental stories come up, and you can model the language and the structure that goes around them. You can also do some more structured activities such as retelling a story from a favourite book or movie, or making up stories together using everyday objects or pictures. If you look up Story Champs on YouTube, there's a nice example of group narrative therapy where a therapist uses visuals to depict each element of the story structure. This is just one way that someone has chosen to do narrative therapy, but there's lots of different methods you can use. I'm sorry I don't have more time to go into further detail on this, but I do encourage you to look more into it. That's all I have time for today. Here are some references. Please feel free to ask questions now.